Hi, I'm Dr. Khadjiah Lang. I am a family medicine with full scope competency in South Los Angeles, and I have been in practice for a significant time.
I'm Dr. Oliver Brooks, board certified in pediatrics, presently a clinical professor of pediatrics at Charles R. Drew University of Medicine and Science, status post or was CEO, CMO at Watts Healthcare Corporation in South Los Angeles. So there's something really important about how do you speak to your patients regarding vaccination/immunizations. I approach it the same way I approach all of my different cultures. First of all, that it is an assumption that you need to or will get vaccinated. It's a concept called presumptive versus participatory. We're not having a discussion about getting vaccinated. I will say, okay, by the way, you need your influenza vaccine, your COVID vaccine, and maybe pneumococcal vaccine. And that's the presumption that you're getting vaccinated. So it's not a participatory conversation now. You need these vaccines, what do you think? So I use that approach on all of my patients, on all of my families.
My approach is, as you said, I too take in mind the fact that if I'm dealing with a family of African American patients, they may very well be bringing with them knowledge of situations that have taken place in the past by our healthcare system towards African American patients. And so though we may share the same culture, ethnicity, background, faith, whatever, there's still that feeling for some patients, not all, but for some patients there's that feeling of, you're a doctor now, you're a part of the system, and therefore I have to keep an eye on you, even though I may not have to keep as tight an eye on you as I would someone else. I have patients that I feel are completely comfortable with me, and I'm very comfortable with them, and we have a very trusting relationship. But I also know I have other patients who, even though I may look like them, there's not that same level of trust in me.
My general approach, and this is in a lot of things that just relates to medicine, is that I'm on your side. And if you saw me as a doctor first and then an African American second, you're right. Because I am a doctor first, and my goal is healing. For doctors to gain trust, it probably is good to be out in the community as opposed to just in the office. The other thing is social media. You can podcast, you can post, you can share links, and that way you can reach people. As we treat and heal a community, that we reach out and do it in the community. In the end, when you look at studies, doctors are the most trusted source for health information.
That's true.
So we have to use your credential at its highest level, because our goal is to keep our people and our community, not just our community, all communities, but we're focused on our community, safe, healthy, and well-informed. And a well-informed community makes good decisions.
Yes.